Hi, this is Jessica DeMassa, and I am here at Health Datapalooza. And joining me right now, I have Joanne Conroy. She is the president and CEO of Dartmouth-Hitchcock. Welcome. Good to talk to you.
Thank you, Jessica.
So give me a little bit of insight on what you guys are doing from a care delivery standpoint that's kind of transformational that you've been talking about here at Health Datapalooza.
So I have the opportunity to be on a panel with other CEOs to talk about our needs in terms of data, but actually translating that to patient care. We have a project called co-production, which is actually getting patients to really participate much more actively in their care. So patients complete a portion of their medical record before they actually get to their appointment. That changes the whole dynamics of the appointment. It's not how are you doing? Is that, they almost complete all of that, and it's just talking about what your goals are and focusing on the things that are really important for them.
Okay, so tell me a little bit about how, I guess, that getting that information ahead of time and some of the things that you're looking for, I guess, outside of the health system, other solutions that can plug into that. How are you planning, I guess, to transform that care delivery experience?
Yeah, we struggle a little bit with the technology, but right now we've identified our inflammatory bowel disease patients because they're people with chronic issues, but we know that patients that are more active in their care actually have a greater success rate and many fewer complications. So they're sent a message ahead of time to complete their assessment, and they actually write a lot, not only about their disease, but what's going on in their life, which does impact inflammatory bowel disease. And then it's actually there ahead of time so the provider can actually review it.
Okay.
And so when they walk in the room, they're talking about the things that are most important to them. Now, technology-wise, it's still hard to get into the EMR.
Okay.
We're working on that.
Okay.
Right now, we're doing a lot of cutting and pasting.
Okay.
So I think we need more and more vehicles that will actually plug right into Epic to allow this to be part of the record.
All right, talk more about that, because I have a lot of startups that watch me. So if you were to give them some advice on working with a health system like you needed to plug into Epic. I think that that's a really important thing, and I think a lot of them know that. But what else? What other kinds of things are you looking for when you're looking for a technology solution that you can integrate into care delivery?
So we're looking for something that's easy for patients, and that would be an app on their phone.
Yep.
We are in the wilds of New Hampshire, and we do have areas that don't have a lot of cell service, but those are decreasing in number.
Wilds of New Hampshire.
Yeah, those are decreasing in number. And something that actually is very patient-friendly.
Okay.
And
talk to me about the provider side, because you often hear it's like the technology is going to stop at the doctors and the nurses if it's not something that they can access or use, or it doesn't fit into the way that they do their jobs. What's your feedback on that?
So the doctors like this because they get a much better insight into their patients.
Okay.
It removes a lot of the rote checklist that often takes up at least 50% of the visit. And that means if they only have 15 minutes or they only have 20 minutes, they can actually focus on the things that are most important to the patient.
Okay.
That's why they're in medicine. And so you see your provider satisfaction go up significantly.
Okay, I want to transition a little bit, and I want to talk to you about just something that's kind of come up and is a passion point for me, and it's about women in healthcare. And so it's not often that I get to talk with a CEO and president of a health system of the nature and the reputation is yours. So, talk to me. Tell me about women in leadership positions in healthcare. Why is there such a disparity there?
So I'll back up a little bit.
Please do.
We realized that, 5 or 6 years ago that there was a lot wrong in healthcare. And, part of my kind of legacy is to actually increase the number of women leaders in healthcare.
Good.
So we started a group called Women of Impact. We're a not-for-profit. Currently, we have about 65 members. We have brought women together over a period of 5 years. And there are women leaders in the policy space, in the provider space, in the insurance space, in the employer space, and in the patient advocacy space.
Okay.
And we focus on mentoring young women. We focus on trying to fix what we can fix in healthcare. One of our big issues is gender equity in not only health systems, but health industry writ large.
Right.
And we're starting conversations about how to launch a collaborative. So number one, people can actually hold the mirror up to their own gender equity within their own organizations. And number two, can we actually develop leadership pipeline programs together? We, for example, at Dartmouth-Hitchcock, we now ask our vendors about the diversity within their leadership teams and their board.
Okay.
And it doesn't...
No, I like that trickles down.
We don't say it impacts the decision, but we're just asking them, and we're willing to share them our diversity, just because we feel it's an important part of being a successful business.
What would you advise, I guess, for young women who are in the healthcare space and who do want to, become a leader one day? What's your best advice for them? Did you get any good advice yourself, or what would you do? What would you advise us?
So I would say networking is everything, and networking with women that feel similarly about moving up in healthcare leadership.
Okay.
I think that finding a group of advisors, we don't call them mentors anymore, we call them advisors, and they can be men or women that actually will help advise you on certain steps of your career.
Okay.
And I think the final thing I always tell women is to be confident.
Okay.
Women often underestimate their ability or their preparedness to jump into the next leadership role, and they're often far too overcautious about stepping into that leadership space.
I love it. We're just going to jump in with encouraged abandon. How about that?
That's right. That's right.
I like it. Okay, so you had mentioned men real quick, and I do want to jump on that real quick and just ask you, what's your advice for men? How do they support that? Because I've had that conversation with a couple guys myself who are just like, I want to support you in becoming a leader in this, but I'm not quite sure how. So what advice would you offer them in terms of being supportive?
So I would say, actually help with constructive criticism when you see young women that long for leadership, but sometimes there's a little bit of a secret rule book that they don't have access to, and often that's information that's shared over golf or over drinks, and sometimes in circumstances where women are pretty careful to actually limit some of their activities in that space. I would encourage all women to play golf, and I would say that some of my best advice has come from men that I've been playing golf with.
Okay.
And it's just kind of a great way to kind of assess what people are like, but also in a very casual setting, really advise people about how to manage problems in their career.
Okay, cool. Well, thank you for the wonderful advice. It was a pleasure to speak with you. I really appreciate your time.
Well, thank you, Jessica.
Thanks so much. This is Jessica DeMassa at Health Datapalooza. Thanks so much.